my name is Lauren, and this is for my gender-based medicine assignment. And we are going to be talking a little bit about gender differences that are in the healthcare setting of an assisted living facility. Sometimes people forget that it is still a medical practice in a way. You are taking care of someone and treating them every day. More and more, we are seeing that we are having people who are transgender, gays, lesbians, kind of a little bit of everybody coming into the facilities, and we have to change the way we think about that in a healthcare setting and treating them fairly and the way they would like to be treated. A lot of times caregivers are mostly female caregivers, so sometimes they can feel a little bit different about caring for someone who may be attracted to a female. So making sure that staff is fully trained. Thankfully, where I work, we run an assisted living facility, and the owners have brought in special groups to do trainings to go over how to care for those residents. So I am going to go over a little training that we went through using Mr. Gecko and Miss Owlette. So here we go. Miss Owlette, how are you doing today? I am doing well. So I'm here to help you take your shower today. Is there any way that you like your water temperature? Yes, I like it just warm, not too hot but not too cold. Okay, let's go help you. Okay, so I'm going to help you with your shower. So first we were going to start with your hair. Please place this washcloth over your eyes. Oh, here is the washcloth, Miss Gecko. I'll be right back. So sometimes we don't realize that our residents may be transgender because if it's the first time we're working with them, we don't always know what to expect. Sometimes, the community liaison and the nurse are the first ones to really meet a patient and go over the care that we're going to be providing you. And sometimes it's a very difficult subject because a lot of times we don't have those questions. We just we look at you and we automatically kind of go with your male or female. Our computer programs do not allow us to say that you are biologically female, but you identify as male. Sometimes notes like that get lost in translation, and it makes it a little bit different. During our training that we saw, it was very good for us to understand that these people are people. We don't need to treat them any differently. You can treat them for who they biologically are with the medicines that they are prescribed by their doctors, who we hopefully would like them to know what they are as far as what they biologically are, because they're the ones expected to treat them. In the healthcare setting of an assisted living, sometimes it's a little bit, like I said, it's different, it's harder. Sometimes they only need a little bit of care as far as medication management. Sometimes they need help with toileting and showering. And for them, it's a very awkward thing because they've gone their whole life not really having to have someone help them. A lot of times the baby boomer generation that is starting to come into assisted living, they still grew up in the area where there was gender roles. Now, gender is what society perceives that someone is. Whether, they see a man on the street, so that's a man, versus that's a female because they're wearing a skirt. So gender is the different traits that someone outwardly has as far as what their appearance is. And sex is actually what, they biologically are. What do your chromosomes say? Females are XX, males are XY. That comes down from the DNA. So treating someone in a healthcare setting as far as an assisted living, we treat everybody the same. We always treat someone who is needing care with dignity, with respect. Sometimes it is a little bit hard to work with someone because they've never had to have that help, and it becomes an embarrassment. So with making sure that we understand from the beginning of what do they identify as, and that's what we're going to go with. Yes, in a healthcare setting, sometimes people who wear Depends, if you have the male parts, it's easier to get the male briefs, versus if you're a female, it's easier to get the female briefs, because it catches urine and bowel movements in a different way, which works a lot better for keeping the residents comfortable if they have an incontinent episode. Skin breakdown is also different between the males and the females. You're more likely to get bed sores if you sit on your scrotum longer, versus females. They don't have to worry about that extra skin sitting there getting breakdown from, sitting in urine or whatnot. So things like that really make sure that we have to present to make sure that, we're there, we're still checking areas that need to be checked, to make sure that they are getting taken care of and getting the care they need, but getting it done respectfully, and making sure that we are treating them not any different, and making sure that they understand that, we care for you, and we don't really care so much about, who do you identify as. We are still going to care for you and treat you the way you want to be treated. That is the most important thing in gender-based medicine and in assisted living, is making sure we understand that, yes, there are biological differences that are different between males and females. Their blood pressures do range differently, so just making sure that you know where the biological standard is of your patient, not necessarily just, okay, that's, Miss Sally down the street versus there's Mr. Jack that's across, the hall. Making sure that it's Mr. Jack, and even if Mr. Jack has female parts, you still call him by his name and still assist him daily with his daily care needs. But you're also, in those more vulnerable moments, you're still checking and making sure there's not rashes going on, there's not, this going on, that going on. Again, a lot of these baby boomers have had to put up a fake face for such a long time because being transgender or gay or lesbian in their era was not seen as appropriate. So having them be able to live the best life that they can now in a society where things are more welcomed, it will let them have the best life to the end of their life. Being able to be around people who can take care of them and do it respectfully. There is a lot of controversy surrounding all of that, but making sure that you just present and say, hey, I'm here to care for you. I don't really mind how it works. Let's just do what's best for you, and just doing it respectfully versus having criticism over, well, they need to understand that just because they have, guy parts and they think they're a lady, they just have to understand that there's still things that go on. So not having that perception, but just having an open mind to treat them the way they want to be treated. There is a lot of differences as far as, they have different medications that they do have. However, even women are prescribed Viagra as a blood pressure medication versus in the male, they use it for other things. And so you just have to understand that there is differences, but there is the same thing as far as treating blood pressure versus treating it something else. So just making sure that you have that open mind and realizing you have to have the thought, okay, on the outward, that's a Mr., but on the inward, it's a Miss, and you need to make sure that you're just taking care of that person physically the way they want to be, but always keeping an eye out for the things that may come up in a female versus coming up in a male. So that is my assignment, and thank you.